saying even if they do remove it, you should wear it. And it feels like, everyone's telling us to embrace the science except those folks who are telling us to embrace the science. What's going to happen here?
Well, what's happening is public sentiment is catching up with public health officials. People are sick of it. A Kaiser Family Foundation poll found that 73% of the public now is extremely frustrated, and that poll was 2 weeks ago. It's even higher today. The science has not changed. When people say the science has changed, now you can take off your mask, the size of an aerosolized virus was always 5 microns, and the size of the pores of the cloth masks were always 20 to 100 microns. So right now people are seeing through the strict paternalism in public health officials telling us to do things, and they see through the foolishness of the myopic nature focusing on this one virus and ignoring overall health and ignoring the fact that young, healthy people were always low risk in this entire endeavor, and yet they bore the biggest burden of restrictions.
Dr. Mackary, there's another facet of this pandemic that seems to maybe be changing with respect to politics, and it's something you're very passionate about, and that's natural immunity. Representative Ted Lieu talked about it. He tweeted about it at least this week, and it feels like, again, it's changing, and maybe it's changing for political reasons. In other words, maybe there was always an acknowledgement of it, but people were afraid to say so. What's going on?
Well, the data are now undeniable. The test of time has held up the doctrine of natural immunity. It's true with other coronaviruses that cause severe illness, SARS and MERS, and that's why the hypothesis at the beginning should have been that it's effective and durable until proven otherwise. Now, we did a study out at Johns Hopkins. My research team published it in JAMA a week ago, showing that 99.3% of people who had COVID had circulating antibodies, and those antibodies were present up to 20 months afterwards. That's as long as the study period. So we've seen public health officials afraid to talk about it because they've had this paternalism that they don't want people to go out there and try to get the infection. But people want things straight. They want honesty, and we can tell people about the durability of it, not ruin their lives if they had natural immunity by firing them from their jobs, and at the same time be honest and encourage vaccination. When we fired those with natural immunity at the workplace, we fired those least likely to spread the infection.
We, and I say we as a nation, appeared to be caught flat-footed with the Omicron variant. Of course, the government's looking for tests. Tests weren't available. We saw long lines in New York City and other places. What should the science community and the government be preparing for with respect to the next possible variant?
Well, we certainly are going to have future variants, and it may be in the fall, it may be a couple of years from now, but statistically those variants are downgrade variants. That is, they're less severe, often less contagious, and it's hard to compete with the already highly contagious current variant. Previous COVID infections and any coronavirus infection is conferring immunity, even if it's an entirely different variant. So that's the natural history of novel viruses introduced into the human race. They downgrade over time and they circulate year to year. In fact, there are 4 other coronaviruses that have circulated for decades, and they constitute about 25% of the cases of the common cold. COVID will be the 5th.
Dr. Mackary, obviously COVID-19 has dominated the headlines for 2 years and counting. But what are some of the other things that we have missed or that we're missing that could actually be just as big in terms of public health threats?
Well, we're learning right now that heart disease is a complication of COVID, and having COVID increases your risk by up to 63%. That's a recent study from this week. There's also many other health problems. Chronic disease and heart disease kills more people than COVID each year. We've had this sort of odd complacency about other respiratory pathogens. They're going to continue to circulate year to year. And bacteria resistant to antibiotics is an epidemic that increases every year. It's not an exponential growth curve, but it kills about 100,000 people a year, and it's projected to increase consistently each consecutive year. And we have too much of a centralization of ideas. We need more of an open forum, and public health officials hopefully have learned that lesson.
Dr. Mackary, one of the things that strikes me this week is all over the world, whether it was in Israel or here in America, we saw scenes of children being told in the classroom, you no longer need a mask. And the euphoria, I mean, I'm getting goosebumps just thinking about some of the videos I've watched in the last couple of days. We talked about the challenges that maybe these kids would have to carry with them. We got less than a minute to go, but do you want to touch on that before I let you go?
This is one of the greatest untold stories of the entire pandemic, and perhaps one of the areas in which history will judge our current public health officials with the greatest burden of responsibility, and that is how this pandemic strategy, not the virus itself, but the pandemic strategy, disproportionately affected poor and minority communities. Most Americans do not live with a second home and an expensive Zoom suite. In